Hyperemesis gravidarum refers to excessive vomiting, usually during the early part of pregnancy, and is usually common. It's a diagnosis of exclusion and therefore important to rule out other causes of vomiting such as malaria, urinary tract infection, gastritis, peptic ulcer disease, hepatitis, and hypoglycemia. And surgical conditions such as acute appendicitis, bowel obstruction, cholecystitis, twisted ovarian cyst should also be excluded. Hyperemesis gravidarum may be associated with multiple pregnancy or molar pregnancy. The main cause is pregnancy. So the symptoms are excessive vomiting, sometimes with inability to keep anything down throughout the day, and inability to eat or drink due to fear of vomiting, and also weight loss. The signs that are usually elicited are the patient looks unwell, dehydration, dry skin, dry tongue, sunken eyes in extreme cases. The pulse is rapid and steady in extreme cases. The BP may be low, and deep and fast breathing in extreme cases. Investigations are FBC, blood film for malaria parasites, urinalysis and culture, blood urea and electrolytes, abdominopelvic ultrasound. Main treatment objectives are to stop the vomiting, to rehydrate the patient, to treat shock if present, to treat associated conditions, for example, UTI, malaria, and pharmacological treatment. So mild cases can have treatment at home with frequent small meals. Dry foods such as biscuits may be very helpful. The dry fluids in sips or small volumes if able to. Pharmacological treatment, mild cases, first line treatment, you give metoclopramide oral 10 milligrams 8 to 12 hourly. Second line treatment, you give promethazine thioclate oral 25 milligrams 8 to 12 hourly, or promethazine hydrochloride oral 25 milligrams 8 to 12 hourly. Severe cases, if normal saline IV, alternate with 5% dextrose to meet requirements, or Ringer's lactate IV, you alternate with 5% dextrose to meet requirements. And first line treatment, give metoclopramide IM or IV 5 to 10 milligrams 8 hourly. And if body weight is less than 60 kilograms, you give 5 milligrams 8 hourly, and do not exceed 500 micrograms per kilogram in a day. A second line treatment, you give ondansetron oral IM or IV 4 to 8 milligrams 8 hourly as needed. And third line treatment, give promethazine hydrochloride IM or IV 25 milligrams 8 hourly, 8 to 12 hourly, the maximum daily dose of 100 milligrams. The referral criteria, you refer severe cases with dehydration or shock and metabolic disturbances to a hospital for intravenous fluid replacement and antiemetic therapy.